Hi, this is Philip Vanderclay with the National Diaper Bank Network. I'm the Director of Policy and Government Relations for those of you who might not know me. And I'm joined today by Kelley Massengale, one of our top researchers here at NDBN. Kelley, do you want to tell us a little bit more about yourself?
Yeah, absolutely. Thank you, Philip. So I have been researching diaper need and diaper banks since I first visited my local diaper bank back in 2014. I had never learned about diaper need or diaper banks until I saw a donation box in a coffee shop in my local town where I live. And so that's how I first learned about this important issue.
Very cool. So you have now done a series of studies on diaper need, and that's brought you to the latest study that was released just this year. Do you want to give us a little bit of background on some of the research that you've done and how that's brought you to what we're going to talk about today?
Yeah, absolutely. So the first research studies I did were really to show the ways that diaper banks can connect families to other services and kind of be a gateway for helping families to have basic needs met, and also to show the benefits that families experience when they are connected with a diaper bank. And so from that work, we know that families are more likely to engage in programs, whether it's a home visiting program. They might stay enrolled in that program longer than before they were receiving diapers through the program, or they might continue to have more consistent care through a healthcare provider if they can also get diapers at the same time as another need being met. We've also learned that diapers help families to experience feel that their kids are healthier. Parents have the diaper need for kids to go to childcare so parents can go to work. So we know that diaper banks are a very important part of the support structure for families and communities across the country. What we didn't really know was how many kids around the country might benefit from receiving services from a diaper bank. And so that's what our current study was to do, to understand so about how much need is there across the country.
Got it. Great. Thanks for that overview. So you referenced the current study and how much need there is, and I think the number that really popped out to me, at least, was that even with how large the National Diaper Bank network is, over 200 members, we're in all 50 states, distributing millions, tens of millions of diapers every year. The percentage of the need, the estimated
And
need
answer
that,
something that maybe you didn't ask.
what was that? Hello?
One of the ways that other people have quantified other services families need, and so sometimes people have a need, there is a different way to quantify how many people might need help from a diaper bank. So instead of looking at only the number of people who have accessed diaper banks, instead we wanted to look at how many people across the country might be experiencing diaper need. And so to do that, we looked at census data to try to have a better understanding of how many low-income children are living in the United States. And then we overlap that with the number of children being served by diaper banks across the country.
Great. So, Kelley, tell me a little bit more about the implications of the study. Now you've done the research, you've seen kind of like the hard data and the numbers, but what does this mean for us, for diaper banks, and for people looking to make a difference in their communities? Can you hear me? Hello? Can you hear me? Sorry about that, everyone. We seem to be having some technical difficulties here with our Facebook Live broadcast. We're going to try to get this fixed.
Sorry, Philip, I'm having a hard time hearing you, so I'll just tell you a little bit more about this study. Um,
Great.
every year, the National Diaper Bank Network asks all of its member diaper banks across the country to provide information on the number of families that were served every month, the depth of their service area, the kind of products that are being provided to families, the number of volunteer hours that have helped their diaper bank to run, how many of their diapers were donated, how many were purchased with donations, and how many cloth diaper kits were provided. And we really use that information to have a sense of how deep diaper banks are working in the communities that they're serving. We found that whenever we look at an area that has a diaper bank, there is a lot of need that's being met. But when we look at the entire country, we know that there are not diaper banks across the entire United States. And so that was part of the impetus for the study, to show how much need there was and to show how much more work diaper banks can be doing if they have the support they need. And then also to show that there's a really important piece there that's missing through policy in the United States.
Thanks, Kelley. So I know you can't hear me, so I'm going to try to send this message. But can you talk a bit more about the public policy and what the responses to public policy in addressing diaper need can be?
There are a great number of things that we can do in public policy to help address diaper need. Some counties have decided to designate part of their county budgets to addressing diaper need in the local community. Other states have decided to repeal sales taxes on diapers, and others have decided to designate funds to diaper demonstration programs or allow families to receive access to diapers while they're enrolled in another policy program, maybe a welfare to work program, or a food bank program where families might also be getting supplemental nutrition. And all of these are things that other states and other communities have done. At this time, what we also need are small local things, things across states, and then also policies that help families across the entire nation.
Great, thank you. And so what are things that, specifically diaper bankers or advocates who are watching this right now can do?
There are so many things diaper bankers around the country can do to help address this issue. First of all, you know diaper need better in your community than anyone else. And so all the people that you're talking to about diaper need, whether it's a volunteer or somebody who comes to your diaper bank for the first time, maybe it's reaching out to your city council to come and talk about diaper need. Maybe it's requesting a proclamation during Diaper Need Awareness Week in your state. Those are all ways to help bring awareness to diaper need in your country. There are also other steps you can take if you want to help move policy forward in your local community or at the state level. And the first step to that is really sitting down and talking with legislators, inviting them to come to your diaper bank and learn firsthand about this issue.
Perfect. Thanks, Kelley. And I think that, another thing that we can mention that we've seen is when people have done that, they've been able to build some really great relationships with legislators who have become amazing champions for diaper need. And just like some of those things that you were talking about early, Kelley, in regards to getting funding or state or local programs, we've seen programs in California get millions of dollars in funding through the state budget to address this issue. In Connecticut, they got funding through the budget. Some diaper banks have gotten some local grants, whether it's through a county or a city. And those have been really successful in expanding the number of diapers that they can buy and purchase. And so just like Kelley said, building those relationships, reaching out and talking to people and raising awareness about diaper need and using some of this awesome research that Kelley has done to have those conversations can really build an effective movement that creates a lot of change. With that, I know you have some more in-depth conversations that you can have about this study with diaper bank leaders across the country, and you've actually set up a webinar for that coming up on February 19th. And so if you just want to give a quick pitch on what you'll go into in that webinar to our members and why they should listen in and join you then.
We're going to be talking more on Wednesday of next week about the study that we've recently had published in the American Journal of Public Health. It's a really big step for the whole diaper bank community because we've gotten the attention of people that are working in public health across the entire nation who might have never heard of a diaper bank before, who might have never heard of diaper need before. So we hope that you'll join us next Wednesday at 1 o'clock Eastern Time.
Awesome. Thanks so much, Kelley. Really appreciate your time and soldiering on with us through these technical difficulties to get it done. And we're looking forward to that webinar.
Thank you so much.
All right. Bye-bye.